We want to welcome you all into Coronavirus Inside the Arizona Numbers. It is January 22nd, 2021. I'm still not even used to saying the new year yet. We're almost through the first month. A lot happening here in Arizona today as it relates to coronavirus. We'll walk you through all of that, talk about some big updates to the vaccination situation here in Arizona, and also take you through all the numbers as we always do to help you make sense of these numbers coming out of the state and make the best decisions for your family and your life as you know your family and their health best. We're just here to help guide you through it. So I'm Katie Rammel, alongside me, Garrett Archer. We will start where we always do with that overall stats page. We are worried that these numbers are going to be higher in the latter part of this week, having the holiday not reported, and we were not with all of you yesterday. So we'll touch on those numbers too. But Garrett, how are the numbers today?
Well, we did cross two milestones today at the same time. The number of cases in Arizona now exceeds 700,000. And again, this is cumulative cases. So all of these aren't obviously current. And then the number of deaths crossed the 12,000 threshold today. So that is two specific, very important thresholds that were crossed. If we look at sort of the data associated with how this came about, I made two very, very quick charts. I'm going to pull this off and just go to it's just, again, simple Excel chart here that we're looking at. We're going to look at cases first. You can see the cumulative movement in the cases and how it started very low, and then it went exponential from June to about the end of July. About 2 months of exponential movement. And then we really slowed off, and it took us from 200,000 to 300,000. It took us 3 months to do that, to just go in that direction. And then from then on, it's taken us, the amount of time it takes us to get past 100,000 cases has started to quicken, as you can see. 11/23 is when we crossed 300,000 cases, and then we crossed 400,000 cases. Let me see if I can get that point up. We crossed 400,000 cases on December 12th. So that's about a half a month. And then 500,000 cases we crossed at December 27th. That's what, 2 weeks, if that, so much less than half a month. And now we're at the 700,000. See, how long did it take us to cross from here? We just hit 600,000 only, I believe. Hold on, it's being a little bit. January 8th is when we hit 600,000. So basically, it's only taken us
2 weeks to get there?
2 weeks exactly to get to 600,000. So we've been exponentially increasing by about 2 weeks every 100,000.
Yeah.
When we look at our second sheet, this is the deaths. You see a similar pattern where the deaths, it took us until July 8th to get to 2,000 deaths. And then it took us till August 5th, so 1 month, to add another 1,000 deaths to that. And then after that, it took another 3 months to add another 1,000 deaths. So now we're at 6,000. And then we started to pick up very quickly, as you can see. So on around November 2nd, we were at about 6,000 deaths. And then at December 21st, we added another 2,000 deaths. So just in that little time span, and then another 2,000 deaths. Man, what is that? That's December 22nd to January 9th. And then the other 2,000 deaths, January 9th to January 22nd. So as you can see, it's taking, again, a little less than 2 weeks to add 2,000 deaths to our system every single period. So just something to think about on how this data is coming through.
Well, the interesting thing, Garrett, I don't know if you saw this question that came to both of us on Twitter, maybe like a week ago. You had posted a list of those dates when you didn't have it plugged into a spreadsheet like that. And somebody following us on Twitter asked you and I, what then happened when we managed to hold off those deaths for that 3-month time frame in there? And that was really residual from some of the July lockdowns and some of the July closures and the mitigation strategies that were taken in there. Just because we didn't have the same sort of situation happening at that time,
Correct.
You have to remember that the deaths lag and that those numbers are not going to show up in real time, but going to be reflected in the numbers sometimes 6 or 8 weeks later. But it was interesting how with those mitigation strategies, we were able to level the curve just a little bit through there.
So when we look at the deaths per week, and this is the actual date of death, not the date it was reported, you can see that right now we are at about 800. At the most recent data we have, that's the best data we have, is January 3rd. Would be the best one we have, and you can see about 840 deaths reported in 1 week. That follows 824. So we were doing over 800 deaths in a week time frame from COVID-19, and the weeks before that it was about 750. Now this January 10th, we're at 600 right now. That is absolutely going to cross into the 800 threshold, and it may even go even farther than that. It may pass 900, and this one may as well. As soon as we get past this one, January 17th, that's when we should expect to see these particular numbers start to go down. We, as we are currently, it appears to be in a decline, but unfortunately, as we talked about, Katie, the deaths take the longest to decline, and so I don't expect to see them start to go down until about this week of January 17th, and then we'll start seeing a downward trend.
Okay, so a little bit of a plateau for now, it seems, as we're hoping.
It does look like we are at least getting into a plateau as far as cases are concerned, which does follow along and will trend to deaths as well. Here's what the cases look like for week. You can see our max cases so far: 64,000 cases in January, the week of January 3rd. It's gone down tremendously since then, 48,000. And in this case, I don't expect this to match 64,000. It will go up, but I don't think it's going to match that peak of 64,000 for that week. And then this one will also be down. It does right now appear, because if we look at our reported numbers, we're down about 20% week over week right now. So it will continue to be there. It will go down, at least right now.
Yeah. Okay, I just want to remind everybody in the comments, your questions are so good. We will get to them. I'm going to rattle off some names: Jem, Andrew, Julietta, Amelia, I hope I'm saying that right. Donna, Dwayne, I jotted down your questions. We'll get back to you. I want to get to some of these numbers that are in here, and then I promise we'll get back to all of you on the questions you're posting. Garrett, how do our hospitalization numbers look? I do have an update that just came into the newsroom literally an hour ago. We have brought in 650 more nurses to the state of Arizona from other places. So these are not Arizona-based people taking them from Arizona hospitals. They're coming from other places. They are still looking to recruit 750 more to offer enough services for people who are heading into the hospital here in the state of Arizona. But once again, 650 nurses have been brought in on an 8-week time span. If their hospital wants to renew the contract that they have with them, they'll be able to do that. But those are the numbers that we're looking at right now. All that to say, you have to be staffed to have it. You can have a hospital bed, but if it's not staffed, it doesn't do us any good. So that's why those numbers are important. Our hospitalizations, though, did have a couple signs of hope.
Yeah, we are seeing declines in both metrics of hospitalizations for about 11 days now. We're down about 10 or 15% from where we were at our peak. This is the ICU numbers. And you can see about on January 11th was our peak at 66%, 1183, and we're down now to 1,054. So we're down a little over 100 beds for COVID-19 in that particular department. You can see they are maintaining levels. There is a small drop for the entire headroom of ICU, but they are maintaining those levels, and they're replacing those beds with non-COVID-19 patients. The inpatient, similar story. We're down about 10% from where we were at the top at about 5,000 to about 4,495 right now, but keeping a headroom of about 92%. So, and we can also see some alleviation in the emergency room beds. And this is where we know that things are starting to go down a little bit. And this isn't just a reporting issue, because these emergency room departments, this is where people are being held if there's no room at the inpatient, at the bed level. So we saw these numbers go up because they were having to keep people in these emergency room departments. You can see they're starting to go down again. So the hospitals have a little bit of a better situation right now. Still full. By no means are they're emptying out, but it seems like as far as COVID-19, it's a little better situation. So other things to talk about really quick, why this could be. Ventilators are still pretty high at about 50%. This chart is kind of interesting. They messed up a little bit in this chart, but it's at about 50% right now. And then when we look at these numbers, I just want to point out the ventilators. Ventilators are down as well from about 800 to about 739, but that's not down a lot. And so what is happening, it does appear with a higher discharge number and a fairly high ventilator number, is unfortunately the ICU fatality rate seems to be going up. And unfortunately, it seems we're losing more people in the ICU. And that's why the ICU numbers are going down for COVID-19, is that people unfortunately are passing away in the ICU.
Garrett, thank you to update us on those. And I know we have a bunch of other numbers to get to. I want to get to some of the questions now that are being asked. Gem, I hope I'm pronouncing that right, GEM is asking about a second dose. And this is really important to highlight because this has, I don't know if that was the question, it might be one before, but anyway, he was asking about how we can get scheduled for a second dose. It is changing right now. So if you have not gotten your vaccine yet, but are scheduled, when you pull through that parking lot starting today, they're going to set you up, and these are at the state-run sites, for your second dose right there, which makes so much more sense than trying to get an email and get back and get scheduled. So if you got your first dose between 1:11 and 1:21, you're now still going to get an email. If that email is not going through, or you didn't provide an email address, the state health department is actually going to call you to get that rescheduled. So again, if you are getting your first dose after today, those appointments are going to be made right after you pull through. When you're waiting the 15 minutes to make sure you're okay, they're going to schedule you right there in the parking lot. So that's all set. Debbie's mentioning something else that's really important. They did announce today that the calendar is going to be different. That was a major frustration on the website. So the available appointments when you're signing up for the state are going to be in green. So the date will look different. So you're not clicking through to try to find out if there was an appointment. They're taking the feedback you guys are providing when you're trying to sign up and making these changes as fast as they can. The other thing, it's not going to have military time anymore. You can use the pull down bar and have a clock like you're used to there to schedule your appointment. That was a factor that was not friendly in there for the system for a lot of people. So you'll see the green on there. You'll be able to click on that green date, and then you'll be able to see the available appointments within there instead of people searching forever. I know that's what my mom went through, typing into each date to try to get past that screen to see if there was anything available in there. Garrett, as we're talking about this, and I'm going to get back to some of the other questions in just a second, we just passed worldwide the second deadliest day so far in the life of this pandemic. So 16,000 lives lost worldwide. Again, the second deadliest day in this pandemic. Do you have any idea how far back the number one spot is on that, or have you seen any numbers on that? It seems like such a high number. I wonder if that came within the past month or so, or if that was maybe in July when we saw the summer.
I don't know. I would have to, let me see if I can look at that while you're talking. I'll see if I can find that graph day.
Yeah. Julieta's asking a question about her son getting vaccinated, asking, he's in a high risk group. And Julieta, I want to answer your question. I need to know how old your son is. That depends on which group he would be in. So at this point, it's all about age, because we're only starting with the first important factor, which is how old you are and what kind of care setting you live in. That's the first group that we've gotten to. So if you're able to answer, I can let you know if that helps at all. Andrea is asking, do you know why high-risk children over 16 can't get the Pfizer vaccine? Andrea, I'm wondering if you're asking about Pfizer specifically or just vaccines in general, because they really haven't done a lot of the testing under that age.
Yeah, so I talked to a doctor about and that's exactly what you said, Katie.
Yeah.
It's because there was no 16, over 16 was not in the study group under 18.
Right.
So
Moderna is the one that had that ability.
Moderna has the 16, but the 16-year-olds weren't included in the Pfizer study group, so they are not approved to take it.
And the other thing in this, Andrea, a point of note, there's going to be so many more studies on these kids, and by the time those come out, so many more studies on the other vaccines, the possibility of J&J up next, the Johnson & Johnson vaccine, and some of the others. So at this point, don't get too hung up on that, because there's going to be so many more opportunities for different vaccinations in the time to come.
I do want to address something. It's kind of interesting. I've seen two comments on it. People talking about why the numbers are still climbing with the vaccines, the miracle vaccine or whatever someone put in there. We've only vaccinated 60,000 people, Bill. That's in Arizona. That's the amount of people. Less than 1% of people in Arizona have a full shot, a full dose, the 95% protection. We simply do not have that many people vaccinated, and that's the reason why these cases are still climbing. When you look at the way the numbers are working, it's going to take another good 6 weeks or so in order for us to have enough people vaccinated that it will actually start to do something to the numbers. That's all. That's what it is right now. The numbers have been climbing because there's just not enough people with the vaccine.
Yeah, you think 331 million people in the United States, and we're only at 39 million for vaccines.
Yeah, and that's only first dose.
That's distributed. Administered is only 19 million. So we're not even anywhere close to.
And remember, all of those numbers are first dose. So, and it's going to be a much smaller number for second dose. That's really where we are. There's just simply not enough people. It's going to take a while.
Yeah, for the second dose, we're only at 58,000 here in Arizona. So 380,000 have gotten their first dose. 58,000 have a complete set. So this is going to take a really long time. In fact, if you take the numbers of whatever you want to compare, whether it's the state of Arizona or the population of the United States, and then divide that by days, that'll give you some numbers on how fast they'd have to get going to have this in progress. I mean, if there's 65 days in the year and you're giving 1 million people a day a dose, it would still take a year to get it done nearly here in the United States. So it's really important to keep all those numbers in perspective, and that's why we highlight that here. One of our reporters, Carla Navarrete, sorry, Carla, I think she was just in the comments here saying there's already a clinical trial going in Tucson for kids. So hopefully we'll get some answers out of that soon as well. Carla, thank you so much. And your reporting throughout this has been excellent. So I haven't gotten to see any of our reporters because it's empty here. So I just want to pass that along to Carla. All right. Where vaccinations are making some headway and fast is Israel. They have already vaccinated 10% of their entire population. In fact, other countries are now watching closely. What's being done? What's different there? What can we learn from what they're doing? 10% already vaccinated fully there. This is not just the first dose. That's a full vaccination. All right, Garrett, some of the other numbers. Were you able to see if we were talking about the deadliest day worldwide?
Oh, yeah, it does. So you were right. It was January, obviously, the 17,484 is the one you were talking about, right?
Yeah.
The next deadliest is January 13th at, I'm trying to get to it, 6,578. And that was last Wednesday, it seems. So
for the U.S. or for worldwide?
You know what? That's worldwide.
That's what it was. The second deadliest day worldwide was 16,000. Is that what you meant? 16,000?
Yes.
You had said 6. So yeah.
Oh, sorry, 16.
No, that's okay. There's so many numbers that I have to remind myself, am I talking cases or deaths or hospitalizations? Okay. So Andrew was asking a question I want to get to. He's saying, why don't you ever talk about who's recovered? Unfortunately, recovery is different for everybody. Some people would say recovery is a negative test. Others are like, I got a negative test, but I still feel awful. So the number that we track best to give you that answer, Andrew, is not recoveries, but who's still active. So if we have 708,000 cases here in the state of Arizona, something Garrett highlighted right off the top, those are not all active cases, but Garrett does the math for us so that we can better understand how many active cases we would have among us here in the state of Arizona.
And I'm pulling it up right now. But so we give you two estimates, essentially. We get people who are under 14 days. That is basically people who are the most active. They literally just got their test. They're within the quarantine period, the recommended quarantine period. So this is the most infectious. And then we give you a 27-day, under 27 days, which would include those people in the 14-day, but also any sort of long haulers or anyone else that may be exhibiting symptoms or may also just have a longer case of COVID-19. And the CDC basically recommends that after 27 days, pretty much there are going to be some long haulers, but it's an outlier at that point. And so it doesn't really affect the statistical significance of this estimate. And what I have is about 87,000 people in Arizona are confirmed cases right now under 14 days. So that's people that literally had their test less than, by just after the holiday weekend, the 8th. I would be included in one of those, of course. And then the high active estimate, that is, oh, thank you, Julie. I'm feeling very well. Thank you. I'm 3 days symptom free and day 11 since my test. So I'm pretty fortunate. And then the high active estimate is under 27 days, 202,000. So that is actually growing, but because our case numbers are starting to go down, the number of 14-day cases is actually is starting to go down. So it was at 99,000 a couple 4 or 5 days ago. It's now at 87,000. So we're starting to see sort of and eventually we will start to see that 202,000 go down as well. There was one time back in September that we were down in the, I think it was actually down in the low teens for the number of cases.
Yeah, it in some ways feels like a lifetime ago, and in other ways feels like just yesterday. So, Andrew, hopefully that answers your question. Donna was asking about some of the population numbers, and basically, Donna, she was asking what's the population of Arizona, about 7.4 million. Maricopa County, you're right, is very populous. It's the fourth most populous county in our state, or in the country. The most populous state in, sorry, I'm going to say this all wrong. The most populated county in our state, the fourth most populous county in the nation. Woo, I'll twist it up today. So yes, it can be difficult to compare some of these numbers, and that's why we're here with you every day to help walk you through it. The count is higher, the raw count. What you want to do is normalize things for population. That's why we try to help with these numbers every day. Garrett and I stare at these numbers pretty much all day long. And one example I always use, Arizona's like a third of the population of Florida. So when Florida was a real hot spot, an easy way to figure if we were doing worse or better was just to multiply any of our numbers times 3. So just remember, Donna, to normalize for population, and then you can get an accurate look at how the numbers truly are. That's what we try to do with you here. That's what you can usually find on most websites. They have a normalized for population bar, and when you're able to click on that, then you're able to see things a little bit better if you want to compare state to state or California to Arizona, Florida to Arizona, things like that. All right, Carnival's been canceled. The other news just coming in this afternoon. It has been canceled. So the huge worldwide event happening in Rio every year is canceled. It's the first time they've had to do something like this since 1932. Not a real surprise that it had to be canceled, as we saw, things like the Olympics canceled last year and different items postponed around the world. But there's just some things that safety measures just won't be enough for the size of crowd that they're expecting out there. So that has been canceled. The other headline today, Dr. Birx has retired. So she was a staple in some of our updates that we got from the White House task force and really helping to spread information about what people needed to do to protect themselves from the coronavirus this past year. And she has just retired. So that of note today. Garrett, can we get into our R0 number? I know we have another thing to celebrate there today with how those numbers are.
Yes, and hopefully it stays this way.
Yes, no doubt.
So our RT, our rate of transmission, we are finally in the green today. This is the first time we've been in the green since, I want to say, not counting Christmas, because I do not count Christmas, where we were posting a green during this daily show since, I believe, the early December. And here we are at 0.99 with a range of 0.79 to 1.2. We are the state at the top of the green pile, if you will. California being at the bottom. You said they were at one point, we were at the same situation as California. They're at 0.84. We're at 0.99 right now, but we are no longer in the red. And I do not presume that this is incorrect at this point, and we should stay under as of right now. Now, of course, something could change as far as if we start seeing increased case levels, then that could that could change. We've got the Super Bowl coming up. I don't know what that's going to do to things, but as of right now, it seems that we should stay in this vicinity.
Yeah. Speaking of the Super Bowl, we do want to highlight that too, because a really awesome thing is happening. They are sending 7,500 vaccinated healthcare workers into the Super Bowl for free. And just what a thoughtful thing for them to do. They are letting 22,000 fans in, but just as a way to say thank you, they're letting 7,500 vaccinated healthcare workers in for free. The ability to say thank you and let them kind of enjoy one day off and watch the game and relax for just a bit. let's see. Monica was asking, if I get vaccinated, do I still have to wear a mask, or why do I still have to wear a mask? And one of the things is they haven't studied whether after you have the vaccine, it is that you can still transmit the virus. So it's protecting you against your body. That much has been studied, but they haven't studied the rest of it yet. Likely it's going to be you won't need to, but at this point, the study is not complete. So they need to find out that information before we can make some decisions moving forward. A lot of people like that variant map the other day, Garrett, that we showed.
Sure.
I'm wondering if we can pop that up again and talk about some of these variants and what's going on.
Yeah, let me pull that up.
The concern is that it's showing up in states all around us. We have not officially had one registered here in the state of Arizona, but when we saw like 40 cases in California and cases really in states and in Mexico all around us. It's just a matter of time if it's not already here in Arizona.
We've talked about this one. It's, we saw this early on too. It says B117, which is the UK variant. 144 total cases in the United States. It's not showing a lot of growth, but we also know that we're not doing a whole lot of sequencing in the United States. So it would be, there's a really good chance we're missing a lot of these. And you can see all around us, California with 40 cases, 1 in Utah, 6 in Colorado, 2 in New Mexico. And I would expect that those numbers are as we've talked about constantly on this show, it takes about 2 weeks for the data to be complete. So we're always 2 weeks behind this virus. That's one of the biggest issues with this thing. Mm-hmm. And so what we're looking at, it's already 2 weeks ahead of this, which means these numbers are much lower than they should be.
Yeah. So this is the place that you can find this. We've only shown this one other time, but a lot of people had asked about that. It's through the CDC and their website that you can take a closer look at that, or if that's something you want to track over the weekends when we're not here with you, that's where you can find this. Jerry's saying the numbers are high because everyone keeps retesting and it drives our numbers up. We actually deduplicate for testing. So yes. Jerry, if you're going in to get tested, you're only counted once. I've tested.
I'll show that really quick for Jerry, just to show what it looks like. The AZDHS was tired of getting questions on this, so they created a dashboard.
You mean we weren't answering it enough?
so that they don't have to answer it anymore. We have 2 dashboards now for tests. We have people tested and tests conducted. So for today, for example, 22,511 new people were tested. But all tests conducted, this is including retests, 55,425 tests were conducted, including those new people. So there's a lot of retests in there. 6.7 million tests in Arizona have been done no matter what. As you can see, 3.7 million people tested, as deduplicated as much as possible. That's approximately half our state at this point. But that's really what we're looking at, the difference between the testing and the retesting.
Mm-hmm. And this is on the AZDHS site.
So I'm seeing Diane Hayward's question or comment, and she's talking about the WHO recommendations on the PCR test, the cycle thresholds. They're saying that the WHO is now recommending that the cycle threshold for PCR tests go down, and I understand that. We in Arizona don't have any control over what the cycle threshold that is done by labs. If Sonora Quest dials down the cycle threshold, then that's what happens. And what she's talking about is there is a large tail on PCR tests for their positivity. Okay, what I think what I don't know what Diana's trying to do. I think she's trying to think that there's a false positive. I don't want to put any words in your mouth, Diana, but if you get a positive test in the PCR, you did have COVID-19. Okay, mm-hmm. No question you had COVID-19. It just may have happened about a month ago or so. So there's a possibility, say you go in and you get your PCR test and its cycle threshold is 40 or 45 or whatever it is. And they say, oh, you tested positive. And you're like, well, I feel fine. Well, maybe you had a nose or a cough or whatever. You had a very mild case of COVID-19. You did have it because it doesn't just make up the virus. It doesn't make up the chemical reactions for the virus. It's just showing what's called basically bits and pieces of what the virus was in your system. So that is the thing that you have to understand about these PCR tests is when you dial down the cycle threshold, the magnification, if you will, then you may not detect the virus when it's a month out. And that is a problem. There's a lot of conversation in the health community as if the cycle threshold of over 40 is worth it or not. If because we are getting a lot of tests coming back positive today of someone that may have had it 2 weeks ago. That's true. So, that's just the way it is. But, something to consider. We don't control our cycle thresholds here. Some states, like I think Florida has said, oh, this is what your cycle threshold has to be. We don't control that here. It's just whatever StarQuest Lab uses and all the others. They put their own cycle threshold together, and we don't even track it. I've asked this before. AZDHS doesn't track it.
Good information. Got us updated on that. Hopefully that helps to answer the question. Let's see. Let's talk about some other issues that are happening with this new variant. So the BBC is out today saying that the Prime Minister is calling that particular variant, and this is all new, 30 times more deadly. You are suggesting we should look at the data a little bit closer before having those numbers, Garrett, be solid. Just because if it is transmitting more, it's obviously going to cause more deaths. We see more, if you have more cases, you have more hospitalizations, you have more, sadly, more deaths. And so you're saying, wait for those numbers just a little bit more as you're seeing some of those headlines.
So I would say, and I even read the article that the BBC put out, and they are even saying they're saying, yes, they have initial data saying that it could be 30% more deadly, but this is done off of data analysis and not sort of more scientific approach as far as just studying, the disease, because it takes a lot longer to study the actual effects of the variant on people, on a case-by-case basis. So they're doing this by data analysts, and there's a lot of confounding variables that you have to understand. You said because it's 30% more deadly, because it transmits at a faster rate, it's picking up more people. We don't know exactly where this is. If this is in if more people that have B17 just happen to not, they might not be similar populations. There could be situations which more people that are in a higher risk group happen to get B117, and it's causing a 30% increase in the mortality. There's just a lot of confounding variables that have to be taken into control. So I would say, while this is an interesting news report, I wouldn't, ring the bells of panic yet and say, oh, this thing's 30% more deadly. I think really it needs to be studied more before that kind of stuff is said.
Right. So something to watch as you're seeing that information come out today. What we are seeing also more from health experts is that they are saying more European countries are now recommending and mandating an N95 mask in addition to your cloth mask. So strengthening some of the decisions being made over there about protection from this virus. So at the very least, they're trying to take some steps to make sure that they're mitigating the numbers that they're seeing over there. The other talker that we've seen today, Garrett, and then we can get back to just a few more of the numbers, is this idea of vaccine tourism. That people are starting to hear which states are providing a rollout in a faster function, and that they're willing to travel to those states to then get their vaccine, whether it's people driving into Arizona from California to get their vaccine, or it's people even booking charters across the country to get to places like Florida. And you were saying even Florida is saying, we got to crack down on this. We can't have people outside of Florida coming in and taking the allotment that is for Floridians.
Yeah, no, it's we're reading that too. It's kind of incredible. You sort of expect it to happen.
Yeah.
But I can see a bunch of states are going to want to have to clamp down on this, because right now where we are, especially we're in the priority phasings that most states are, this is not a situation which you want people to be doing vaccine tourism, going from certain areas, especially if they're not high risk areas and they're not populations. You don't want to waste these vaccines at this point. There's a reason why they have these vaccines prioritized the way they are. Now, you can argue around the margins on if the prioritization were correct. Should they have done, should a 30-year-old nurse get the vaccine before a 75, 80-year-old long-term care facility resident? Totally understand that argument. But does a 40-something-year-old person who lives in a suburb or in a very wealthy neighborhood in Los Angeles, should they get the vaccine before any of those people? And the answer is absolutely not. With the vaccines that we have.
I mean, the equity of distribution is going to be something that is also discussed for a very long time, and whether things are fair. Speaking of which, the distribution, we are getting 84,000 doses here into Arizona this week. That does not mean there's 84,000 new appointments out there, but that is our allotment of doses that is showing up this week that we have ordered. So they get their delivery every single week here into the state of Arizona. They order them. They know about how many they're going to get. And that is part of the total of nearly 1 million that we're expecting here in Arizona. And Garrett, when we look at those, and you're talking about priority groups, it's worth highlighting where our counties are in this process. La Paz County is the only county that's left in Group 1A. Right. So that's they're trying to get done with all of their essential workers in Group 1A. Navajo and Santa Cruz counties are in full 1B. And the rest of us, as Garrett's showing you the list there, are in priority 1B. So that's that bumped up group of those who are working in our schools, our frontline workers, our firefighters, police, things like that, all in that priority 1B group. For the most part, it is 75 and older. A lot of people have seen the 65 and older that were allowed to sign up. Those are through the state sites. I cannot tell you how many questions I get on that every single day. The counties are still at 75 and up, or your priority groups. If they are 65 and up and trying to sign up, you have got to go to the state-run sites. Those sites currently are full. There was a new pod added on today at GCU. So at the school there, that opens on Tuesday. That does not mean, again, that there are more appointments, and we'll continue to keep you updated when these other appointments open up. Also, that pharmacy partnership that we have here in the state of Arizona, getting 64,000 doses. It's going to be 400 sites now in Arizona who have the vaccine this week. So that can be anything from the CVS and the pharmacies that are going into our long-term care facilities, to our counties, to our pods that are set up throughout the state. So just to get you updated.
There's another CVS. CVS is actually one of our reporters sent in saying that they have a data set for vaccines, for how many vaccines that CVS has distributed. And
is that a nationwide list, or is that split by Arizona?
Wide list.
Yeah.
It looks like they've they distributed, including first and second doses, 1,339,365. In Arizona, they have done 91,000 vaccines. CVS has done 91,000 vaccines.
Yeah.
And as far as the long-term care facilities,
we've gotten 140 sites already vaccinated here in Arizona, but we've got 2,000 sites that are all signed up for the facilities here in the state of Arizona. So we do have some work still to do as far as getting those out. And there's been a lot of concern, and we hear you when the questions are coming in that, you know, my family member lives in a long-term care facility, yet I'm seeing lines and lines of people go through the site out at State Farm Stadium. What's going on? And that's just part of how they're distributing these. But we understand the concern when you're seeing that out there. Garrett, when you showed some of those vaccination numbers, I just want to highlight for everybody what our total numbers look like, and they can see county by county and county by county, and then the state overall. One of the things so many people also asked is, why are we not getting the same number as this county? Why are we not getting the same number as this county? It is distributed by population, and by population specifically of your priority group. So they look at the number of Group A. So it's not just, you know, how many people live in Yuma County, but how many people in Group A are in Yuma County. That helps to see that site on there.
Yeah, absolutely. So this is that numbers we were looking at with the partial series versus the completed series. So 315,000 people in Arizona have gotten at least one shot of the vaccine. 60,000 people have gotten their completed series. So that's sort of the way you look at this. It looks like 38,000 total administered. Yeah, I guess those are combined, obviously.
Yep.
So 380,000 total administered, but really it's 315,000 people with at least some protection, 60,000 that have that 95% protection.
And this is the list that comes out each morning, late morning hours. So anybody that wants to see this again over the weekends or when we're not here with you, that is usually put out on their Facebook page too for the general public.
Usually around 11 or 12 is when they pull it out. Usually 12. They say 11, but it's noon.
Yeah. So hopefully that helps to answer some of the questions. I do want to find out what you're going to be watching this weekend, Garrett, as we head into a couple of days away. And then if we have any time left, I can answer just a few more questions from people.
Yeah, I think at this point, one of the things that we're looking at right now, of course, is going to be the COVID-like illness. This has been. Let me show where we are. We haven't looked at the COVID-like illness numbers for a while, so let me just show where we are right now. These we were seeing these go up, very quickly. December 20th at a 26% rate for inpatient and 17%. You can see it did go down for the week of the 27th, and it stayed about level for the 3rd. This does. I don't use this number right there. We don't know what this actual number is. We're waiting to see this one updated to what its actual number is. We really want to see this number start to go down, because while we're seeing what appears to be a decline in the hospitalizations, this would help us confirm that the decline is in fact a real decline.
Yeah.
So we're wanting to see these numbers, and since it's Friday, these things update on Sunday, so we're going to be looking mostly at that, and then also to see if the trends continue. If the hospitalizations continue to go down, if the case numbers continue to go down, then eventually the deaths are going to go down, and we should be on a downward turn. So that's sort of where we are right now, and hopefully that's the way it stays.
We're also seeing still on Saturdays some high numbers, or some numbers that we're seeing throughout the week.
Should be a very high number, especially.
Yeah.
We could still see a very high number in deaths tomorrow, just to understand where we're only at. I think when I checked today, we had reported 750. Yeah, 750 deaths so far this week were reported. So this is just when they announced it. That last week's death number of reported was close to 1,200.
Wow.
So there could be a couple more. We're
high days in there.
Martin Luther King Day. It kind of messed up the death reporting for this week, but that's going to just carry over for these reported numbers longer. So just expect some higher numbers for a bit longer.
And with those higher numbers, the thing that's been talked about this week, if y'all hadn't caught it throughout some of our newscasts, but will this then become the leading cause of death for the state of Arizona? And we are very close to that, because right around 12,000 is cancer and heart disease in the state of Arizona.
I just want to do one thing here with I don't even know if they're talking to us, but Jamie Snow is saying, so if they die of a heart attack but tested positive on COVID was the cause of death. Well, yes, COVID was the cause of death, and COVID and heart attack will be on the death certificates. Don't just have one line that said how you died and they just say COVID there. It will say, it usually gives the absolute cause of death. And this is the same thing with a gunshot wound. If you take a gunshot wound, your heart stops, you die of some sort of cardiovascular situation. Same thing with COVID. You died of a heart attack because you had COVID.
Right.
So yes, that is exactly what it will say. And as it should.
Yep. I think that's what's confusing for so many people is, I guess thankfully they're not familiar with death certificates like so many have to be in their industry or because they've lost a loved one. But there is not just one line there that's filled in. It's not one decisive thing that takes you out. I mean, there's a list there, and Marina writes, COVID could aggravate the heart condition that caused the heart attack.
Absolutely.
So, Marina, thank you for weighing in. That's exactly the situation.
Jamie saying it was a joke, and I don't know who he was talking. I don't know if the context was, but for anybody who has that question, I hear that all the time.
Yeah.
Whether that was directed at Jamie or not, Jamie, I apologize if you were making a joke, but what I'm saying is that I see this all the time. People saying, well, people died of COVID, but they died with COVID, not from COVID, or whatever the argument is. But again, if you had a heart attack and you had COVID, it likely exacerbated by COVID. And then they're going to go through and research this. And there's a likelihood that if it wasn't, they'll take COVID off. But possibly most of the time, yes, you died of COVID because you had a heart attack. This is all the way it should be.
Yeah, it was a question I didn't get to from Dwayne a long time back. So I apologize at the beginning of this. Dwayne was asking about the deaths that are like that and asking why sometimes they're not on the curve for 6 to 8 weeks. That is exactly it. They're being investigated to try to find out more information about what this person died of. It's always plugged into the epi curve on the date they actually died. But, it takes some time to look into these. So. Yes. All right, that is probably going to wrap it up for today. Oh no, Margaret's saying I'm scared, sick, waiting for results. Oh no! Margaret joins us on here many afternoons. No! I hope you're feeling okay and that you get an answer soon.
Okay, Margaret.
Oh my gosh, you guys. How many awesome people have we met by doing this each afternoon, and names that we get to see so often. Yeah, and Kimberly's sending a good message to her as well. I hope you get a good answer soon. So all right, and hopefully your daughter's okay, Margaret. Okay, so that's gonna be where things wrap up today. Everybody, be safe out there this weekend. We know that there are a lot of active cases, so wear a mask, be careful, stay home if you can. All the things, wash hands, distance. You know the deal. You know the drill. Here's where you can find us. Here's where you can find our reporting. abc15.com/coronavirus is our. She's saying, oh, she's good. Good. abc15.com/coronavirus is where you'll find all of our reporting. You can catch Garrett's updates still coming to you on the weekend, even though it's his day off, at Garrett_Archer.
Anyway, so whatever.
Yeah, I know. You're stuck at home. He's in quarantine. All right. And then my Twitter account is at Katie Rammel. Many of you, since you're on Facebook with us right now, you can find me on Facebook at facebook.com/news from Katie. And we'll be back here with you next week. I'm back on kid duty, helping the kids with school, so I won't be here on Monday. So Garrett, I don't know if you'll be doing an update, but in the meantime, I'll see you guys back on Tuesday. Everybody, be safe out there.